Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick, a chiropractor out of Commerce Township, Michigan, and we're here with our returning guest again, Dr. Ryan Cooper out of Northville, Michigan.
Hello, thank you. It's an honor to be here.
So today we'd like to start out talking about some of the anatomy of the spine and some words that a lot of people hear and really what they mean and their function in the spine. So a lot of people here, when you hear about the spine, they hear the word discs, spinal discs. So I want to talk to our audience a little bit about what those discs are, what they do, and how they work, and how we can help with them.
Yeah. Well, basically what a disc is you have two normal vertebrae, and then what you have between it is a disc. It's almost like a little sponge, a spacer, so to speak, in between the disc. And what that does, it allows the spine, the 24 bones, to move and be able to bend. And then also what it does, it gives space for the nerves to exit the spine to control the function of the body.
So essentially they're shock absorbers.
Shock absorption, yeah.
Exactly.
Yeah.
So the way these discs work is, like you said, they're like a sponge, right?
Right.
And with a sponge, fluid comes into it, fluid comes out of it. You know, if you take a nice wet sponge, threw it in the road, a car could run over it, not a big deal.
Right.
Squishes right back up. You take a dried out, wrinkled up sponge, toss it in the road and run over it, parts of it are going to crack. It's going to break.
Right.
So most of these discs are made up of water. Water is the main essential ingredient in a spinal disc, these shock absorbers.
Right.
So the way they work, like I said, they're like a sponge, and with proper motion, when they have proper motion in the spine and in the disc, the good things like water, minerals, nutrients can come into the disc.
Oxygen, yeah.
Oxygen comes into the disc. The bad things like scar tissue or inflammation or cellular debris can leave the disc.
Right. Right.
Without proper motion, when they start to get locked up, over time these sponges start to dry out. And that's what we would call disc degeneration, degenerative osteoarthritis. And we have a picture here of this bottom model. This is where the disc actually starts to lose space as compared to the other one here, nice thick puffy disc. We see now here degenerated smaller disc, like a dried out wrinkled up sponge. And what happens to the bones is what we start to call osteophytes or bone spurs. Many people have heard that word. That's another buzzword with the spine too. They say we have bone spurs.
I have bone spurs.
So what happens is as the disc starts to degenerate, there's differences in the calcium deposits, and they actually start to form or melt around the disc. That's what we call bone spurs. And even they can come so close together they can even start to fuse together, these bone spurs. Osteophytes, or again, degenerative osteoarthritis. And that's what arthritis is poor misalignment over time, where it starts to degenerate, deteriorate, or wear out over time.
And over time, when it does that, what it does is it starts to impinge or pinch and irritate the spinal nerves, and that's when typically you have symptoms. You see, the problem has probably been there for 20, maybe even 40 years, and then it gets to a certain point where the straw breaks the camel's back, and then boom, now you have some issues and some problems.
Exactly. These discs don't degenerate overnight.
Right.
And now new research is showing that discs can start to degenerate as young as, how young can we even start?
Age 8.
Age 8. The disc can already start to lose shape, start to degenerate a little bit from age 8 and on. So this doesn't happen overnight. It could take days, weeks, months, years, decades for them to start to degenerate.
Right.
And again, the scariest thing is we don't always feel that.
Right.
We don't feel the disc start to degenerate.
You can compare it to anything that's chronic or long-term, like heart disease. You know, heart disease doesn't start in your early 40s, and then when you're 50, you have a heart attack.
Right.
It can happen as young as age 8, even age 3. They've done studies where actually you can start to see plaquing of the arteries, and then years and years and years of abuse, and then you have your last symptom, which is unfortunately a heart attack.
Don't just wake up one day and have a heart attack. It took years for the arteriosclerosis to build and build. And the same thing happens with degenerative osteoarthritis in the spine, where it takes time for this to build. And so the ways to prevent that, slow down the arthritic process, is to have proper motion of the spine. So things like exercise. We always hear that exercise is great for the spine and for the core. That's another big word people hear is you want to work on your core. So core muscles are in our trunk and torso. They go right around the spine. They hold it together. So if we keep normal motion, we keep a strong core, we'll prevent the decrease or range of motion or lack of motion in the spine that will lead to the degeneration. So exercise is great for the spine, and specific exercises are even better for the spine that target and focus specifically on the spine itself, what we call spinal hygiene exercise. The more of that we do, the better. And as chiropractors, even more importantly, is we want to exercise the whole spine in one fluid motion, but also we want to make sure that each vertebrae is moving properly intersegmentally between one another as the vertebrae move between one segment and another. And that's what we do as a chiropractor. We find locked, immobile vertebrae, we get them moving again so that we take pressure off of those discs, off of those nerves and off of the spinal cord so that we can get that normal fluid. We can keep it as healthy as possible.
Yep, absolutely. And what can happen is as the disc starts to degenerate, it becomes weakened. And then what can happen is, unfortunately, it can bulge, right? So we have a model here that actually shows the disc actually bulging out of the vertebra or out of the spine. Sometimes it can put pressure on the nerve, so that's where you have people where they have shooting pain down their arms, down their legs, sciatica pain. And at this particular point, it's typically a little bit more difficult to work with, but with conservative chiropractic care, it can help with a bulged disc
Absolutely.
as well.
And some other buzzwords that we use for the same thing is they say bulging disc, slip disc, herniated disc. And again, we said these discs are like a sponge. Another way to describe them would be like a jelly donut, right?
Jelly donut.
Take a jelly donut. If you squeeze it, eventually it's going to start to poof out a little bit.
Right.
And that's what happens with the herniated disc, where we can see that the disc is actually poofing out a little bit. And again, like you said, the disc can actually, as it poofs out, can put pressure on that nerve, can put pressure on the spinal cord or the nervous system there. And when it does that and irritate the joint, when it does it, that's when we get, like you said, the lightning bolt down our arms, lightning bolt down our legs, numbness, tingling in the feet, numbness, tingling in the hands. And depending on which area that is, which disc, tells us which area of the body that it would control.
Absolutely.
So now if you squeeze the jelly donut, it poofs out. If you squeeze it a little more, what's going to happen? Eventually,
yeah, then it's really bad. Yeah.
The jelly's going to leak right out of it, right?
Yeah.
And that's what we call a ruptured disc. And that's where it's, call 911 disc is ruptured, and it's actually leaking that disc material into the spinal cord onto the nerves. And so with the herniated disc, like you said, most people think if you have a herniated disc, the only option is surgery. And you and I know, of course, that's not the truth.
Yep.
That we see people in our offices all the time with herniated discs, and we have awesome results. Is that correct?
Oh, it happens. We've had patients in our office that actually scheduled for surgery maybe 2-3 months down the road, and fortunately they were able to meet me and then never had to get the surgery, which is very, very fortunate.
I see the same thing. And I always tell them that they have nothing to lose to give conservative chiropractic care a try, give it a good effort before they have the surgery.
Right.
They don't even have to change their surgery, but give it a try. There's nothing to lose.
And of course it's very safe too. A lot of people think, oh, they have a disc herniation, they don't want anybody messing with it or anything like that. But chiropractic care is very safe, very effective for helping people with disc problems.
And a lot more gentle than most people think.
Oh yes, absolutely.
So I have a study here. This is a peer-reviewed journal called the Journal of Manipulative and Physiological Therapeutics, peer-reviewed journal. This is a study talking about the MRIs and clinical follow-up, a study of 27 patients receiving chiropractic care for cervical and lumbar disc herniations, like we were talking about. This study suggests that chiropractic care may reverse disc herniation. 27 patients with MRI documented and symptomatic disc herniations of the cervical or lumbar spine were given chiropractic care, flexion distraction, and some rehabilitative exercises. After the MRIs, the post-MRI showed that 63% of patients had reduced size or completely reabsorbed disc material. And 78% of the patients were able to return to work completely pre-disability condition.
Yep.
So 78% were back to normal, and 63% completely or shrunk in size or completely reabsorbed the disc herniation, which is amazing.
Yeah, no, absolutely. And it's, instead of degenerating further or getting worse, they actually regenerated, and the body functions a lot better at that particular point.
And so again, there is of course a time and a place for the surgery to get there and remove the disc, especially when it's ruptured, but there's never anything wrong with giving chiropractic care a try before that. We have amazing results. As you can see here, surgery is not the only option for disc herniation, slip disc, bulging discs. Not at all. Something that we can see all the time.
Absolutely.
And the last one on this model that we'd like to share with our audience is what we call compression fractures. When the spine can be weak, can lead to more susceptibility to compression fractures. And you can see here these little fracture lines in the body of the vertebrae, what we would call compression fracture. A lot of times people have it from, they fall off a roof, they land on their feet, and the pressure went right on the spine and caused these minor micro compression fractures here. Now,
or with somebody with severe degenerative osteoarthritis and osteoporosis.
Osteoporosis, osteopenia, where they have lack of bone cells, decrease in bone cells, or weakened bone cells. Makes it a lot easier for these compression fractures. Now with these, what I hear a lot of people are told, a lot of people come to my office and they say, I was just told by the TV, by my friend, by my doctor, whatever, that we need to take calcium as we're aging, especially females here. We need to take calcium, right? And I want people in our audience to think of that just like gravel we know is the main ingredient in concrete, right? But if you took a bunch of gravel and you threw it on a concrete porch, it's not going to grow the porch.
Right.
It's just going to sit there on the porch. Calcium is the main ingredient in our bones, but without the other ingredients that would churn it into concrete or the strong bone matrix, it's not going to build strong bones.
Right.
So when people take a calcium supplement, the only thing to do, the best thing to do is make sure it's that guy the entire calcium complex. Things like calcium, magnesium, manganese, zinc, phosphorus. They all need to be in there to help churn it into a strong bone matrix.
Absolutely. And of course, just staying active, exercising, especially weight-bearing exercise, what it does is it's kind of that use it or lose it law, and that really helps maintain and build better bone strength.
Strong bone matrix.
Yep.
So I want to switch over and talk a little bit about some of these spinal hygiene exercises. Now, of course, everybody thinks about oral hygiene, dental hygiene, but most people don't think about or talk about spinal hygiene.
Right.
You know, they brush their teeth every day, and then they also see a dentist, just like a lot of people see a chiropractor, but don't think about doing anything on a daily basis for their spine. So we have a program called Straighten Up America, which we go into school systems, school districts, and teach children at a young age about spinal hygiene. I do this in workforces. We do it in nursing homes. We want to train as many people as we can to do normal spinal hygiene exercises. They'll help strengthen the muscles around the spine and keep normal motion of the spine to prevent some of this osteoarthritis, this degeneration that we're talking about. So I want to switch over. We're going to roll a clip, and this is going to be a clip of me training a workforce. It was about 80 people that we trained on normal spinal hygiene exercises or the Straighten Up America posture exercises. So if I can get everybody for a second, I'm going to have you guys stand up. We're going to talk a little bit about stretches. I want to see if we can make a little bit of room. I'm going to go over some proper ergonomic stretches and spinal hygiene exercises. Now, spinal hygiene is very similar, believe it or not, to oral hygiene. And most people don't do anything for their spinal hygiene, but of course they do a lot for their oral hygiene. So how many of you guys here brush your teeth? Hopefully a lot of hands go up, make sure. Everybody brushes their teeth. We want to keep their teeth as healthy as possible, but most people don't do anything for their spinal hygiene, which is, even though your teeth are very important, they help us chew our food, it's not protecting and surrounding our spinal column and our nervous system. So it's very, very important to do our spinal hygiene. Now, the worst mistake I see so many people make with their spine and their back and their body in general in this country is that most of the time, they wait until their spine or their back is physically killing them until they're laying on the floor to even think about it. Now, let's say you did the same thing with your teeth. You never brushed, you never flossed, you never went to a dentist until your teeth were just killing you. What are they going to say? Too late. Too late, right? Now some of the teeth are rotting from the inside out, some need to be pulled, some need to be filled. And a lot of times it's very similar in the spine. So we want to make sure that we're proactive when we take care of ourselves before there's an injury, not just waiting until there's an injury to take care of ourselves. So the first one I want us to do here, I want to stand up nice and straight. We're going to talk a little bit more about posture in just a minute, but I want to make sure to put our ears over our shoulders. Shoulders up, ears over shoulders, not sticking out forward like that. We call this usually the inner winter posture. And the next thing I want us to do is a stretch called the eagle. We're just going to, like an eagle's arms, bring your neck back, look up, bring the hands all the way up, take a big breath in. And then breathe out while you bring it back down. So big breath in, going up, looking up. And big breath out. Big breath in, and out. For time purposes, we're just going to do a couple of those there. Now the next one we're going to do, we call this the hummingbird. We're going to put our arms up just like this. Again, keeping that posture, ears over the shoulders. We're going to bring the arms back like this. Feel the shoulder blades come back together. Want to feel those muscles stretch between the shoulder blades. Feel them come back together. Keep the ears over the shoulders. We're going to go off to the side a little bit. We call this one the drunk hummingbird. We're going to go over to the other side. Ears over the shoulders. Not too far. We're just going to, when we do the side, we're just bend a little. We're doing the drunk hummingbird, not the wasted hummingbird. We're going to go back to the middle here. Next thing we're going to do is the butterfly. We're going to put our hands right behind our head. We're going to pull our head back. Feel the resistance with the hands. You got it. You're moving to the side a little bit. Perfect. You move it to the side a little bit. But I want us, don't keep the head forward. I want to keep the head back. And I want to strengthen those muscles. Another easy way to do this exercise is while we're driving in our car. Most people while you're driving in your car are driving like this. An easy way to do it, you know, you drive to work, is to put your head against the headrest. Very easy. As you're driving in your car, put your head against the headrest. We want to keep these muscles strong that'll keep the head back. And I'll talk a little bit more later about the posture, why it's important to have our head back and not pushed out forward like that. So I want to make sure to keep the head back. And then another one I want you guys to do, just going to rub the muscles in the back of the neck, loosen them up a little bit. We call this the trap opener. Get a little bit lower right where the trapezius muscles are here. Rub those a little bit. And give ourselves a big hug. Going to stretch the muscles right again between the shoulder blades there. And then I'm going to show you guys a couple more. You guys may not have room for these ones right now to do these, but I just want to show you guys here. We're going to stand like a star. We make our body into like a star. We're going to do one is twisting like this. Just going to stretch, twisting like this, twisting star. And another one we're going to be tilting with it. Stretch out the back there, tilting. And then one like this for our core muscles. Bring the leg up, and we're going to switch sides. So again, the birds, we had the eagle, we had the hummingbird, the drunken hummingbird, then we had the butterfly, we had the trap opener, we gave ourselves a big hug, and then we did those stars. So I'm going to go over those again with you at the end, and I have those on a website, we can always go over those again with you guys. And really for just 10 minutes a day, you can do those in 5, 10 minutes, you can even do 2 minutes. Really will make a big difference in the spine. So one more thing, you guys can have a seat there. Give yourselves a big round of applause. A lot of people stretch their lower back out like this. We don't want to do that. We don't want to stretch our lower back out like that, but we can do it while we're sitting in a chair. So we call it the forward bend. We sit in a chair and we just stretch our back out this way while we're sitting in a chair. That way we don't put the pressure on those discs in the bottom of the spine. So as you can see there, the more people that learn about it, the healthier spines will be in the long run.
Right. No,
so
absolutely. And
it's our mission to train as many people and teach as many people some normal spinal hygiene stretches, exercises, things they can do on a daily basis to keep normal and regular motion within the spine.
And of course, being under regular chiropractic care can ensure, along with the exercise, can really ensure that that spine will be as healthy as it could possibly be.
Absolutely, absolutely. That is the most important thing, because the chiropractic care is going to keep the spine in normal alignment. The exercises are going to keep the spine strong, and keep more motion, but it's not going to keep motion intersegmental or between each segment. So I want to switch over and talk with our audience here about a couple of different misconceptions and the phases of chiropractic care.
Absolutely. A lot of people will always say, once you go to a chiropractor, you have to go forever,
right? That is the big misconception.
That's absolutely not true. Of course, we can't force anybody to go to see a chiropractor for their entire life. So basically, in our offices, we offer about 3 different types of care, and we educate people so they make informed decisions on what level of care they'd like to participate in. My
mission in our office is just to support people with what their goals for their health are.
Absolutely.
We don't want to push them to come in all the time. We don't want to push them and tell them come in whenever you feel like it. If they do want to come regular, and depending on what their goals for their health are.
Absolutely.
So one example I like to use with people is, people say once you go to a chiropractor you have to go forever. It's a lot like many other things, like let's say brushing your teeth. Once you start brushing your teeth, do you have to brush them forever?
No, absolutely not.
You don't have to, but is it going to be good for you?
Yeah.
You know, I hope people would continue. Once someone starts exercising, do they have to exercise forever?
No, they certainly don't.
They don't. And some people we know go on a workout streak, January 1st comes around, they're working out, and by March they're done for a while, and they go on and off. And some people do the same thing with chiropractic care. Once you start exercising, you don't have to do it forever, but is it going to be good for you?
Yeah,
of course. And chiropractic care is very similar. Once we have a healthy spine, do we have to work on maintaining it or keeping it healthy? We don't have to. We can wait till symptoms arise again, or we can maintain it and keep it as healthy as possible.
So basically, with that being said, there's basically 3 types of care. The first type of care would be a symptomatic type of care, or what we call initial intensive care. It's initial, and it's more frequent, and it's more intensive, designed to take care of the particular symptom that you're coming in with.
Specifically,
so if it's
to get them feeling better.
To get them feeling better. Typically, it ranges anywhere from days to weeks to even a couple months, even 3 months. And then we get to a point where somebody's asymptomatic, or they're feeling much, much better. At that particular point, they can choose to participate in what's called reconstructive care, where that's still fairly frequent care designed not only to take care of symptoms, but really that's where you see the soft tissue healing, the ligaments, the tendons, the discs, of course the nerves of the spine. And what that does is it really gets the person healed up, and it sets the stage for prevention.
And that's where we'll see more of the structural changes that we would see on an X-ray or MRI, rather than just functional change where they're feeling better. Now, if we look at this model here, we see the muscles and ligaments that surround the spine, right? These are those core muscles that we were talking about earlier. Now, if we use the example that, let's say someone has big crooked teeth, and they say they want to go to orthodontist and have their teeth fixed tonight so they can have a good picture. Well, they're going to say, well, of course you can, right? They have to have braces, it takes a long time. Usually after braces, have to wear a retainer, because otherwise the teeth start to go back out of place. Now what happens, depending on how long the damage has been in the spine, whether it was from something like bad posture over years and years, these muscles and ligaments start to get tight on one side and stretched on the other side. Or from a major collision, an impact, improper lifting, a car accident, whiplash, sometimes there'll be minor or micro tears in the muscles and ligaments, and they'll heal wrong. So now over time we go in and we make an adjustment. And I know as people get adjusted, sometimes they hear the big popping noises and they think the bone's moved right back in place. We're moving just millimeters at a time. So we'll make an adjustment, and over time, these muscle fibers start to stretch and pull back out of place. And that's why through this reconstructive or corrective care, we want to move it again and again. We want to retrain it over time to move more and more towards the right position and to hold for longer and longer. And once we've got it into our achieved or desired position, or wherever the patient would like to stop the corrective care,
right,
and switch to the next phase, then we start with
what we call in our office wellness care. Now, a lot of people sometimes would call it like maintenance care.
Maintenance, oftentimes we refer to as maintenance.
Yeah, you know, maintenance to me is kind of boring. It's like, who wants to just maintain anything? No, you want to keep building better health over time, and that's what wellness is. And these are the people that are typically already eating healthy foods, they're exercising on a regular basis, they have the air purifiers, you know, purified water, they're doing all these other health-orientated type of activities, and they utilize chiropractic as another piece of the puzzle to keep their overall body as healthy and really be as best as they can possibly be. And these are the people that bring in their children for chiropractic care because they want their kids to be as best as they can possibly be. So wellness care is more the ongoing care, the kind of care where you would go for the rest of your life. And not only do you stay healthy, but even you can, as time goes on, you can continue to get healthy. What's really exciting is we have a study here that talks about people who were under care for 2 to 5 years. So they were under regular chiropractic care from 2 to 5 years. And what they found is that these people actually had better DNA repair in their body. They measured 3 types of people. The first was people with active disease, such as cancer or heart disease or diabetes. The second type of people who were presumed healthy but weren't under chiropractic care. Then they had people that were healthy, of course, and under chiropractic care, and they found that these people had the highest levels of what's called serum thiol. And what that is that measures in your blood the level of oxidative stress or free radical stress on your cell tissues and walls. So they found these people were at a whole nother level of health and well-being, not only in how they felt and their quality of life, but cellularly inside their body, which is pretty exciting.
They're regenerating, right?
Yeah, yeah.
And so there's a couple buzzwords you threw in there when we talked about the serum thiol levels and how that relates to oxidation in some of the cell tissue and free radical damage. So those are, I know, a lot of buzzwords that people hear frequently nowadays. They hear free radicals, they hear antioxidants. You know, you always hear you want to add more antioxidants to your diet. Fruits are good antioxidants. So I just want to explain a little bit what those words mean and how the study is so awesome and what it really relates to the health of the body through chiropractic care. So let's say we took an apple, right? We cut it in half. We left the 2 halves here, right? Let's say one part of the apple we just left like that, but the other part we put some lemon juice on top of it.
Oh, yeah.
Okay? So we leave the apple just laying there open. Eventually, it's going to start to turn brown, right?
Right.
What's going to happen is the organic tissue in that apple that turns brown, that's where it became oxidized.
Right.
Completely exposed to oxygen. So the lemon juice on the other one is going to prevent that apple from turning brown as fast. And so in this example, the lemon juice would be serving as an antioxidant. Right. That's what they would say these fruit juices and citrus specifically are very good antioxidants. Prevents the oxidation from happening in the cell tissue or in the organic material, as what you would see by the apple. Yeah. And so this study, we're talking about the serum thiol levels as a measuring tool to talk about the level of oxidation in our cell tissue, the cell walls with our DNA, and the free radical damage that happens in our body. Now, there's free radicals everywhere. Those free radicals can cause tumor, cancer, sickness, disease, all sorts of things. And there's free radicals from outside, but also our body can internally create free radicals. Right. And we have our own antioxidants internally throughout our body. Right. And that's what we measure through these serum thiol levels. Right. And so what the study showed is people that are under wellness, maintenance chiropractic care, had better serum thiol levels, and their bodies were naturally making these antioxidants and preventing the free radicals from breaking down the cellular tissue and breaking down the DNA structure. Yeah, and so each time the cell or the tissues in the body would regenerate, or each time it would replicate and reproduce, instead of reproducing being sicker and weaker, it would actually reproduce and be stronger and healthier. So then that allows that person to stay as healthy, not only quality of life, but perhaps even quantity of life. And not even just them replacing being sicker or weaker, but even just replacing being the same. Right. Not even replacing the same, they're now replacing healthier and stronger structure. Right. Which this was really an amazing study that shows the improved immune system function in general of chiropractic care.
Yeah.
Now this really puts it in concrete evidence where, we've been talking for 100 years as chiropractors about how we can improve the immune system through working on the nervous system and the spinal cord.
Right.
The master control system from brain through the spinal column to the organs, the tissues, the glands, the periphery, and the rest of the body.
Right. No, absolutely. It's just, this is a landslide study that really helps us kind of support, and it allows me, when I educate my patients on what long-term care can do for them, it allows me to say to them, hey, not only are you going to be feeling better routinely, but also you can improve just overall, almost like anti-aging, so to speak.
Right,
yeah,
exactly.
That's basically what it is.
Exactly.
Which is, I'm sure a lot of people are into anti-aging, especially the moms in the office.
And so in our office, we have a few different types of people that could come in. We have the people that come every once in a while for specific pain.
Right.
They say they have a bad back,
Right.
and they want to come in every couple months when it goes out. When they say it goes out,
Right.
and they'll come in a few times, and we won't see them again for a few months, they'll come
Yeah.
back. And that's great. If that's what they want to do, I 100% will support them. We are totally here for them to do that.
Right. As long as it's an informed decision.
As long as yeah, for me the most important thing is educating them on their options.
Right.
Right. Letting them know the way the spine works and what we can do. So we have those type of people. And the next type of people are the people that are under corrective care. They see what their x-ray looks like. They want to improve the spine, not just the function. They of course want to improve the function and somewhat the structure of the spine.
Yep.
Exactly. And then we have what we as chiropractors find the most joy in taking care of is people under the
wellness care. Yeah, and then again, these are the people that they want what's best for their families, and they bring in their whole family for regular chiropractic care to stay healthy, to build better health, prevention, to be the best they can be. And these are the people too that are like, they're so excited about it, just like we are, and then they go and they're referring in their friends and family members. It's like they can't shut up about chiropractic.
And they come for overall health rather than just symptoms.
Yeah, they come in for overall health rather than...
And not only do they feel better, but a lot of times these people notice other health, what I call side benefits.
Yeah.
They feel like they're sleeping better, or they breathe better, or they're more attentive when they're under regular chiropractic care compared to when they're not.
More energy, and then typically they need to take less medications and things of that nature, which they're really excited about too.
Absolutely. So we just have a couple minutes left, and I'd like, if you could, Dr. Cooper, share with us maybe a testimonial that you've experienced in your office sometime recently that...
Yeah, just real quickly, just this past week, I've had a real miracle happen in the office. I was taking care of a mother in my office for a year of care. She went through all initial intensive care, all of reconstructive care in the office, and through that time, she was kind of one of the people that was just wanted to take care of her symptoms and really wasn't concerned about anything else but her. And I showed her re-X-rays and actually showed the disc regeneration, showed better alignment in their structure, and of course she felt a lot better after a year of care. And then she goes, would this benefit my daughter who's having very, very bad constipation? She's been this way for about 10 years. I said, I can't promise anything, but I'm going to do my best. And of course, her daughter started care the next week, and without having a normal bowel movement in about 10 years of her life, from that point on, she had a bowel movement every single day, which the muscle, of course, and how that happens is the nerves that control the muscles of the lower back also control the digestive and reproductive organs. So if we can adjust those areas and improve the function and structure of those areas, typically things like constipation or other digestive issues improve almost immediately, especially in this, she was a 13-year-old girl.
And that's amazing. That just goes to show, though, sometimes it can take that long for people to really start to understand it, because it's a different model than most people grew up with, than most people understand. It took her a year to really understand the depth of chiropractic care and how it can help the nervous system before she finally took the step and said, hey, Doc, can this help my daughter? And, it would have been nice if it would have happened a year ago, but at least it happened then. It's a really amazing case. It's a miracle.
And to see the daughter walk in after her first adjustment, and I noticed something was up because she walked in, she had energy, she wasn't all bogged down. She's been sleeping better as well, and it's just a real blessing. Of course, mom's happy too, right? Because she feels like a superwoman, because she helped her daughter, and which is exciting stuff.
Well, that's fantastic. So thank you for joining us on Ask the Chiropractor. This is Dr. Cooper. I'm Dr. Adam Rodnick out of Commerce Township. Thank you for joining us. We'll see you next time on Ask the Chiropractor. Remember that God gave you the gift of life, and what we do with that gift is your gift back to God.